What's going on, guys? Welcome back to another video for self-corrective movement therapy and pain management. So today we're going to look at some spinal rotation, band assisted joint distraction, right? Yes. So we're really going to look at basically the hip joint and utilizing a little bit of rotation with the spine. But here's what we're going to do. We're still anchored low. I'm going to anchor this right at my hip crease, okay? So now I can slide back. I want some really good tension to it. Guys, this band is about maybe a 3/4 to an inch band. If you can use a little bit of thicker one, an 1.25 inches, maybe an 1.5 inches, it'll give you some really good traction at the joint capsule. But play around with what you have, and obviously start light, and if it feels better, go heavier. So, anchored right at the crease, I'm going to lie on my back. Now I can reset it, okay? And what this is doing is I'm just going to hold this leg, and this band is going to pull my femur head that way. So it's cleaning up some tension and space in my hip capsule. Now, I can come forward and back with this. Right? If you're getting any pinching on the inside here, I want you to let your leg track out to the side. Okay? If you're not getting any pinching, I still want you to let your leg track out to the side. Why? Because we're looking for different angles to unglue the tissue in the joint capsule area. Okay? Which means we want to have movement. So again, straight in, out to the side. My foot's relaxed, this leg is relaxed. I'm just using this hand to kind of guide and pull. If you want, you can straighten this leg. Okay, and the same thing, we're going to come across. Now, if you come across, this is where people will get a lot of pinching. If you're pinching, please don't do it, or try to shift your body slightly and see if that makes a difference, okay? Just to target a different angle. So again, band is still here. What I'm doing is applying a nice pull in some multi-plane directions. I'm going to take my hand to my foot. If you can, we're not forcing, remember. And I'm going to let my hand hold my leg. And this is just a nice stretch, okay? We have the glute swirl video, which the band is anchored at my heel, pulling me this way. So now we're anchored at the hip, pulling me away. And I'm going to still do the swirl. Okay? There's no tension in this leg. I'm holding it with both hands. I'm moving it with this hand. And what I'm going to do is I'm just going to let it come across. I'm going to rotate with it. So, as I rotate, if you can get this foot to the ground, I'm holding my leg in place, and now I'm just going to let the band pull me this way, okay? So I'll switch legs so you can see that. So we're anchored up, right? Flat, ins, outs, diagonals, kind of across, clean it up. Now I'm pinchy on this side, I can feel it. So, all right, I'm going to shift my body. I'm going to grab, instead of at my knee pulling across, pay attention to where you're grabbing. I'm going to grab lower and pull up. Okay? That clears my joint capsule. There's no pinchiness in here. Here, definitely pinchy. I don't like it. Here, easier, smoother. I feel the hip flexor starting to let go rather than pinching. So that's where I would grab. Okay? We circle, right? Little circles. Now when I rock, I'm just anchoring about my heel or my ankle, and I'm going to rock. Okay? And that's flat, and I can feel that my right side is just a mess. So I feel this in my QL, I feel this in my lower back, and I feel it because my hip flexors are tight. So this is where my restriction is, in my hip flexors. And that's what's pulling on my lower back. That's what's giving me pain. So we're looking to just clear out that joint capsule. If I need to really roll completely onto my side, do that, okay? Again, we're just targeting some angles. I can apply a little bit of pressure and relax. Okay. If I can open up, great, open up, stay there. So again, we're moving the hip through some ranges of motion while we have the band tractioning at the hip capsule. So it's moving and helping to pull our femur away from the joint capsule and unglue some of that tension and stickiness, right? So that feels better, but I can see, and you can see, my right leg sits a little bit higher, it's a little bit more off kilter, it's tighter, it wants to pull and pinch. So that's an easy assessment that I can tell for myself where I'm kind of in some restricted movement patterns. So, thanks for watching, guys. As always, if you have questions, shoot me a message. I know this was a little bit of a longer video. I wanted you to get the understanding of it. It's passive, so we can do the same movement standing, but if you're in pain, you're activating a lot more muscles in a standing position than if you're in a lying position. So try it, shoot me any messages, pain questions, restricted movement problems, anything you got for me, or if you like it, send me a message and tell me you like it, and it really helped you out. I appreciate that too. Thanks for watching, guys. I will see you in your next video.